Hi, I'm Hope Stalker with Acute Care Education, and today I'm going to be talking about insulin pen practice kits. So these are going to be coming on your unit so that you are able to practice giving insulin injections while using our insulin pens. The other thing that these kits will be used for is there's fake skin in here that you guys can also use to have the patients practice with fake skin, as patients might be going home more often with insulin pens. So this is what your insulin pen practice kit looks like. If we open this up, there's alcohol swabs in here. This is the fake skin. We have insulin pen needles, and we have our insulin pens. So insulin pens, there's a few different types of insulin pens that we might have. This particular pen is the U500 insulin pen. It's a highly concentrated insulin pen. So that's what this particular one is. We might be adding Lantus pens, which have a little bit of a different technique to it as you guys are administering those. We also have step-by-step instructions with tips on giving the medications, as well as administration techniques and things like that. So please review this as you're working with your kits. So if I were to give an insulin injection, I'm going to be looking at my insulin pen. So there's a cap in place right here. So if I pull that off, I also have a little window that's going to tell me how many units of insulin I'm giving. Now, because this is highly concentrated, each click is 5 units of insulin. And so I can see in the window here that I've clicked it to 5 units. So if I were to click this 3 times, that'd be 15 units of insulin with this particular type of medication. So as I'm working with this, and I'm going to be attaching my insulin pen needle. So the insulin pen needles look a little bit different than they would with your other types of insulin syringes. So it comes like this. You take this cap off here and clean my tip with just like you would a vial. So we're going to clean with alcohol. And then you take this cap off. Now be very careful because there is a needle in there. And so I'm going to attach this to my insulin pen. Now I'm going to take this first cap off. Be careful that you save this. This is how you're going to be taking off that insulin needle after it's been used. So I'm going to set that off to the side. There's also a shield, a second shield here, so I'm going to be taking that off as well once I get my insulin unit ready to go. So with these particular needles, you have to prime the needle to make sure that patients get all the medication. So I'm going to turn this to 5 units, which is 1 click, and I'm going to push the knob, and as I do, I'm going to look at the tip of my needle to make sure that fluid is coming out. So I'm priming my needle. I'm also making sure that my insulin pen is working. So here we go. And this is a brand new insulin pen, so I saw no bubbles, so I'm gonna do it again. There we go, there's some bubbles. So now I know this is primed. I also know that this has gone back to 0. So let's say that my patient is supposed to get 5 units of U500 insulin. I'm going to turn this to 5, make sure that my skin is clean with alcohol, and I'm going to get ready to administer. Now the administration technique is a little bit different. So when we hold this down, so a little poke, I'm going to push my plunger, but now I have to count. So after this has gone to 0, I count to 5. 1, 2, 3, 4, 5. That's to ensure that the patient received all the medication. Now Lantus pens, for example, the instructions for those are a little different. You may be asked to hold for 10 seconds with those. Now watch as I demonstrate how to safely recap the insulin pen. So I have this cap from before, and I'm going to be very careful that I scoop this used needle up and I cover that needle. Now in order to remove the needle, I just turn it off, twist it, and it will come off. So now that needle is safely inside this pen, and then I can recap this. So this would go in the sharps container. recap this, and this is a multi-vial, so I can use this next time for my patients. Thank you very much.